Hello, my name is Jacob Katsnelson. I'll be talking about postoperative complications associated with reconstruction in head and neck cancer. Free flaps have really become the surgical standard of care compared to pedicle mycutaneous flaps for reconstruction of large defects after resection for head and neck cancer. Flap selection remains to be influenced by institutional resources, surgeon experience, and patient factors. The question we sought to address was which patients are still undergoing pedicle flap reconstruction, and how do their postoperative outcomes compare with those patients who undergo free flap reconstruction. We did this by launching a query of the ACS-NSQIP database. We conducted a review of data from NSQIP from 2011 to 2016, including all patients who underwent resection for head and neck cancer. We broke down reconstruction based into free flap, pedicle mycutaneous flap, and no reconstruction. We then used propensity score matching to account for variables such as patient comorbidity and disease burden between these three groups, and looked at outcome measures in 30 days postoperatively as listed here. The results of our study included 4,712 patients, 28% of which underwent free flap reconstruction, 4% underwent pedicle mycutaneous flap reconstruction, and 68% of patients belonged to this no reconstruction group, which were patients that either primary closure of their defect or local tissue rearrangement. We can see that some of the differences in the demographics: more patients who were smokers, had dyspnea, had severe COPD or an open wound infection, and a higher ASA class were more likely to be found in the pedicle flap group compared to free flap. More patients who had 10% weight loss in the 6 months preceding surgery or disseminated cancer were found in the free flap reconstruction group, likely correlating to a greater disease burden requiring greater resection and a larger flap. After propensity score matching, we can see that the incidence of several postoperative complications is more likely in pedicle flap reconstruction, including DVT, sepsis, surgical site infection, wound dehiscence, pneumonia, and hospital readmission, whereas bleeding requiring transfusion or mechanical ventilation greater than 48 hours is more commonly found in the free flap group, likely correlating with the complexity of the operation, including a possible need for tracheostomy for resection of very large areas. Mean operative time, interestingly, was higher in the free flap group, but perhaps clinically not as significant as anticipated, with 578 minutes for the free flap versus 440 for pedicle flap reconstruction. Here are the odds ratios for pedicle versus free flap. We can see that the odds for a DVT, sepsis, or infection are nearly twice as high for this group after accounting for medical comorbidities and disease burden versus the free flap group, whereas ventilation time greater than 48 hours and bleeding requiring transfusion is lower for the pedicle group versus free flap. But interestingly, many of these other 30-day outcomes, including hospital readmission and hospital length of stay, are not significantly different between the two groups. So we conclude that despite having a slightly longer mean operative time, free flaps are overall associated with less postoperative morbidity in terms of infectious complications, DVT, and sepsis compared to pedicle mycutaneous flaps. They have a similar 30-day postoperative complication rate in terms of hospital readmission and hospital length of stay, as well as cardiac complications and several other commonly recorded complications in NSQIP. This really supports the emerging trend that free flaps are superior, not only in terms of functional aesthetic outcome, but also in impacting postoperative morbidity and operative time. There are several limitations to our study, including that it's from a large national database, doesn't account for some institutional bias, and does not control for this the size of the defect, as well as some patient factors such as previous flap failure. Thank you for your attention.